We believe at Schulich that the major challenges in healthcare are getting increasingly complex and require the capacity to understand the diversity of players. And without that understanding, you can be banging your head up against a wall. You may have a brilliant idea, but if you don't know how to make it play out in the marketplace, and the marketplace includes government, not-for-profit, and the for-profit sector, it's a great idea that's not going to go anywhere. So one of the real perspectives we have at Schulich in this program, Schulich generally, but also this program in particular, is to really get people to understand the other players' perspectives so that they can negotiate with them better, they can understand them better, they can collaborate with them better, and compete with them better if that's what the case is, but really understand how the players fit together. So that really is a key part of our philosophy. And so diversity plays out at Schulich in all sorts of ways. The students come from across the world. And some of our students have extensive healthcare background, clinically or at the bench or in sales or in health charity or public policy. Some have no health background whatsoever, but they're drawn to it, to the field because they really oftentimes they want to make a difference, or they just see it's a huge opportunity, a recession-proof industry, which in the last few years has been very attractive to students. So half of our faculty are academically trained and the other half are practitioners. So for example, the CEO of a hospital. Now that's a pretty cool way to learn about strategic management of hospitals. And at the same time, you'll have a physician who is incredibly academically trained from the US who flies up from Kellogg to teach about international healthcare systems. So we get a great mix of practitioners and academics, so students get the theory, but they also get the practice, always interwoven back and forth. Everybody's looking for leaders and leadership these days in healthcare. I think what we're trying to do at Schulich is recognize the leadership potential in everyone at Schulich, but also having them recognize the leadership potential in the many, many players that are out there in the healthcare. There's a huge untapped resource out there in healthcare. This is a field which we need to have leaders who have the capacity to listen deeply, to understand those connections, to make those breakthrough ideas. That's what leadership in healthcare is going to be about. It's not going to be about driving a single agenda. It's going to be listening and connecting, and that's what we're trying to do at Schulich. Students don't apply for the specializations per se. They apply for the MBA or the IMBA programs, and then once they are in there, they have a core curriculum which everybody takes, and then they can choose to specialize in one or more of these arenas, including the Health Industry Management program.